Hi, everybody. My name is Kayla Jacquez, and I am your regional manager from GD. I'm sure some of us have talked at some point talking about CarePoint stuff or this eBridge stuff, and I just want to do a quick in-service on the new templates that EMS are going to be using. So you guys have seen throughout the MCA that they've had these other forms that they were sending into your ED devices, whatever you have eBridge loaded on. So now they are going to be using an updated form that we have seen be very successful and bring a ton of value to not only the hospital side, but also the pre-hospital side. So essentially, I'm just going to show you what we recommend as best practice. You may or may not have all of this or maybe planning to implement this, but just wanted to give you guys kind of a little bit of a visual. If you guys have the CarePoint system, highly recommend if you go to upgrade to provide a second screen so that way you're able to operate eBridge effectively. And we can dig into this a little more. Please don't hesitate to reach out to me with any questions that you have. This again is just going to be a quick in-service for you guys, but I'm more than happy to help out as needed on an individual hospital basis. So essentially you'll have your CarePoint. You may be getting eBridges on your CarePoint, or you may be getting them on a second screen. And then this also offers what I like to refer to as our dashboards. Dashboards are something that can automatically populate whenever EMS sends this information in, or if you were to fill it out when EMS calls in. And it just gives you a really standardized view and essentially EMS bed management, what I like to call it. But this is just going to kind of be our best practice, and we can definitely dig into this more on an individual basis as needed. So that is what that looks like. I also wanted to show you guys here, you are going to be the hospital side over here to the right. EMS is going to be over here to the left. So they will have updated buttons that are specific to STEMI, stroke, and trauma. Also their EMS, medical type reports. They have been geared to fill out the STEMI, stroke, or trauma buttons if they think that that team internally is going to need to be activated, or if they have that specialty diagnosis out in the field and they feel that you need to be prepped on STEMI, stroke, or trauma. That is how that will come into your hospital. We're also going to have their EMS report, which is going to focus on anything that's not time critical, right? So none of your time critical diagnosis. So they'll be able to pick your facility, and then they'll have attachments that live at the top. So they'll be able to attach maybe a vehicle accident. It could be a photo of an EKG, for example. It could also be a video of a stroke assessment. I've taught them as well, kiddos, right? I have a 1 and a 2-year-old at home. Being able to share with this platform how that kiddo is presenting is going to make you best prepared prior to their arrival, which is exactly what we'd all want. It hits close to home with our kids. So having the ability to take a quick video clip is going to be a game changer for them as well. So we'll just say here, for example, we're going to do the EKG. We've also taught them that they need to take a quality photo out in the field. They do have driver's license scanning as well. Some of them may be able to use this, and then others may just fill this information out. They then can pick the priority level, and that's going to be color coded for you. Low is green, your priority 3s are green, priority 2s are yellow, and priority 1s are high. They have their chief complaints here, so we can just say anxiety, for example. They'll be able to go in and fill this information out here. And I'm not going to fill all of this out because I want to show you how this is a live platform. They can go in and fill out GCS, for example, and then they're going to press notify. When they press notify, it's going to come over to your hospital. You're going to get that notification. Your main goal is to open the notification. And then when you open this notification, you have 90 seconds to acknowledge them, okay? So please make sure this flashing button down here, you have to press this button within 90 seconds so that way they get the closed communication that you have acknowledged their message, okay? So I want to reiterate that. Your main goal here is to please press this acknowledge button. When you press this, it automatically goes over to the EMS device and it lets them know that the hospital has gotten their notification, and it also timestamps it, okay? So anything that happens throughout this platform is timestamped and dated. So please, please, please press that acknowledge button. You guys are now in a live communication thread with one another. Okay, but I will show you, since it is live, they could actually begin to update information on their side, and they're going to be able, you'll be able to see this over on your side. And you have that over there, as you'll see. And same thing for you. So let's say after you review this information, you can actually put in the room number. And when you put in the room number, it is going to not only update them, so they'll know where they're going prior to arrival, but it also could update your dashboards. So you're going to be able to see, let me remove some of these, just so that way you can kind of see that it's going to update in real time of where that patient is going. If we went in here, for example, and this would actually be filled out automatically. You would not have to go in and fill this out. But you could go in and let's say we want this patient to go to room 15 instead. You can update it in real time, and they're going to get that notification as well. All right, so you guys are now in a live environment. The other piece of this that I want to tell you guys is they may try to call you through this platform. Okay, if they do try to call you, please make sure that you're trying to answer. Same for you. You can now call them directly through this platform. So you guys both are connected. Once one of you sends the notification and presses acknowledge, you guys are going to be able to communicate with one another, not only via call, but also via chat. Okay, so chat lives right down here as the group chat. You can open this up, press group chat, and it's going to pop open this guy here. And you can, test, for example. They're going to get that automatically on their side, and you guys can officially chat back and forth. This is something that is heavily used in my area here in Missouri, and they're loving this. For example, there was a seizure patient that got transmitted to the hospital via eBridge. They texted back and said, are they still seizing, right? And you would be able to, clearly I can't type today, you would be able to send that over to them. They would be able to get that, and then they could tell you if they were still seizing or not, and I could immediately just tell you no. You get that right away, and that then lets you know, okay, this patient could potentially go out to triage and just get some blood work and scans and things like that, right? So just know you have the group chat function, you also have the call function, and then the two other pieces, EMS may notify you in real time if something's changed, okay? So they have the ability to let you know, do I need an airway? Do I need the resuscitation team, or did something worsen? So I've taught them, for example, if patient's circling the drain, right, they're able to push this notification to your device. It's going to automatically open the case and take you directly to the bottom and highlight it for you to let you know patient condition worsened. When that comes over, they have been taught to update the case and let you know what has changed, right? Whether they put something in an open text box, whether they chat it over, whether they update certain vital signs, maybe all of a sudden they lost their pressure, who knows what the case may be, but you are able to go up in your document and you're going to be able to see what was updated. All right. And you'll have a little red dot. My demo's a little messed up here. I apologize, but you would have a little red dot to what would be updated. This may show it on here just so that way you can see it here. And then when you open it up, it's going to show you what's happened there. Okay, so there are going to be some growing pains. This has changed, but bear with me. I promise this is going to be a really solid form of communication. We just have to work with one another and try and navigate through this. This is going to be taking place of their radio or phone reports. So we just want to make sure that you're getting the information that you need in order to be best prepared. If you don't feel like you have enough, this is where, again, you can chat or call them to try and navigate through this. The last button that they have is CPR in progress. So this button is when they're stuck in the back, they're by themselves, they don't have a whole lot of help, right? And the patient codes. And they need to be able to notify you immediately that the patient's coded. As opposed to you guys being stuck on the phone trying to communicate or communicate via radio, they have a really quick way to let you know that that has occurred. When that happens, you will get that notification on your side, and it is going to timestamp and date it. So that way you can be best prepared whenever they get there. Okay, and this is what this image looks like over here. You click it, you can press open. I'll pop this up. and you're able to actually spin this around, zoom in, zoom out, etc. All right, I'm really excited. I hope you guys are really happy with this new model. It's going to give you, again, that live environment as opposed to before it was those PDFs that you had to save and things of that sort. Now it all lives on this document here. You can see via your dashboards all of these different cases. You can also go back to this case view and look at other cases that you've had within a 12-hour range if needed. But on your dashboard, this is where those EMSs will live. The other function that you have, in order to remove them from your dashboard, we need to make sure that we're pressing EMS patient arrived, okay? So whenever you press this button, it is going to tell the system that they have arrived, and it will remove 5 minutes after you've pressed that arrival button. If you guys have any issues, if you want to press this button and make sure it automatically removes, please just reach out to our support team. They can help you adjust whenever you press this button when you would like that to actually remove from your device. Okay, we can do that, on a per hospital basis as needed. So please, again, don't hesitate to reach out with any questions or concerns. We hope this is a great tool for you guys and super successful. I hope you guys have a great day and looking forward to talking soon. Thanks so much.